Good morning, everyone. Okay, and so here we are, and the health and well-being of the American people is in mortal danger as the Senate continues votes on Trump care. Republicans may call their latest iteration, we call it repeal and run plan, they may call it skinny, but it is huge in terms of the cost increases and coverage losses it will cause for hardworking American families. The CBO found that the premiums will soar, plans will evaporate, and millions of families will lose health coverage. Sherry Bustos of Illinois. The concern I have is that they pass a bill that is going to have millions of people lose their health insurance, costs to go up, benefits to go down, and they call it skinny. Huge cost for the American people. And so two options can happen. One is that they try to ram it through the House, that just send over the skinny repeal, or they then send it to conference. What we have been talking about all along is let's have a conference. We had a conference on the health care bill when we passed it before, and let's have that be the regular order. Democrats and Republicans at the table in full view on C-SPAN into the public view as to what that debate is about.
Nice to see you too. Yeah, right. I've only heard about this. I'm not sure what the whole interplay is. All I would say is, as you know, Reince is a very close friend of mine. Reince is doing a fantastic job at the White House, and I believe he has the president's confidence. So if those two gentlemen have differences, my advice would be to sit down and settle your differences. I think Reince is doing a great job as chief of staff.
On healthcare, does skinny repeal actually fulfill the promise you've been making for 7 years?
I'm going to reserve judgment until I see what the Senate actually produces. As you well know, they're about to go into their vote-a-rama, which is all of these amendments. It is anybody's guess what they come out with. So we're going to reserve judgment until we see what the Senate actually produces. The problem here, or the concern here in the House, was whether or not the military will be forced to pay for these surgical procedures. I share those concerns. The question on the broader issue, that is being reviewed by the DOD and the White House, and I look forward to seeing what it is that they actually produce.
Last question.
I haven't given thought to that. I think it's in the president's interest that he stay where he is and that he continues and does his job.